Good afternoon, everyone. We'll get started in just a minute, but we are going to allow for more people to join the call before we get going. Okay, thank you for joining us today. I'm Andrew Sorensen, spokesperson here at Steve Boulder. I'll be moderating today's call. Our focus today is to discuss the campus's approach to public health and safety as we prepare for the fall semester, which starts in less than 2 weeks. If you have a question for our panelists on today's webinar and you're watching this via Zoom, please use that Q&A function at the bottom of your screen to submit a question. You can start doing that now. If you happen to be watching this via YouTube instead of Zoom, please be advised that we may not be able to get to your questions. We will do our best to get to all of the questions we received today. If we do not get to your question, you can reach out to us at colorado.edu/COVID-19. Our panelists will answer your questions until the scheduled end of the session. If by chance we run out of questions prior to the scheduled ending of the webinar, we will end early. And as a reminder, today's call will be recorded. On today's call, we have Chief Operating Officer Pat O'Rourke. We have Provost Russell Moore, Associate Vice Chancellor and Dean of Students J.B. Banks. We also have Senior Vice Provost for Academic Planning and Assessment, Catherine Eggert, Associate Vice Chancellor of Health and Wellness Services, Jennifer McDuffie, and Assistant Vice Chancellor of Employee Relations and HR Operations, Lisa Landis. Now I'd like to introduce COO Pat O'Rourke, who will get us started with some opening comments.
Okay, thank you, Andrew. And Andrew, can you nod if I'm coming across audibly and visibly? Perfect. So I want to be the first of my colleagues on the call today to welcome you to this discussion. We're all excited for a return to a more traditional in-person campus experience for this fall. And we recognize that both in our community and across the United States, the rise of the Delta variant has people feeling anxious. And we want to start by reminding you that vaccination remains the most effective way that you can protect yourselves and your loved ones from COVID-19 and its negative effects. I'm going to be sharing some data in a moment, but we've got pretty good uptake of the vaccination in the Boulder community. Almost 80% of the Boulder County residents are vaccinated, and we're trusting that the measures that we're outlining for the campus will well position us to be able to return to campus and fully engage in the fall. There's a few recent developments that I want to be able to highlight. First, as you've likely heard by now, CU Boulder will have a mask requirement for indoor public spaces, regardless of vaccination status, starting on August 13th, 2021. I'll be explaining the particulars of that requirement in a little bit, but this is something that we felt we needed to do because of the increasing rates of the COVID Delta variant, and that we want to be able to make a decision that's going to support the public health and safety of our community and support a consistent in-person experience this semester. We've been in consultation with local public health authorities, including the Boulder County Public Health Department, about the conditions in our community and what we need to be able to do to make sure that we're maintaining the continuity of our campus educational experience without either a change of modality or capacity restrictions. And let me explain by what I mean by that, which is that we've been faced in the past with having to move classes that were scheduled for in-person online. And we've also been faced with circumstances where we wanted to be able to offer more in-person experiences and couldn't because of social distancing and capacity restrictions within the classroom. The actions that we're taking are designed to make sure that we can remain offering in-person instructional experiences and that we can make them as available as possible to CU Boulder students without social distancing and without capping the number of people in the classroom environment. This requirement is going to be a temporary precaution during the Delta surge to supplement our vaccine requirement and provide a multi-layered approach to keeping our community safe. We'll continue to work closely with Boulder County Public Health as it considers public health requirements in our community. And if they adopt any requirements that modify what we're implementing, we'll immediately inform you. But in order to understand what we're doing, it's important for me to give you some information about what's happening in the community itself. So I'm going to share my screen to allow me to be able to present some of that data to you. Andrew, can you confirm for me that that I've been able to share my screen?
It is sharing.
Thank you. Okay, so the first thing that I wanted to talk to you about is what is going on for a vaccination status within the Boulder community itself. Currently, there are approximately 75% of Boulder County residents who are eligible to be vaccinated who have received the vaccine, and 80% have received at least the first dose. What this doesn't reflect, however, is that this means that there are more than 40,000 people within the Boulder community who are not vaccinated, either because they're not eligible to receive the vaccine or because they have chosen not to receive it. By age group, we are seeing that the 12 to 19-year-old population and the 20 to 29-year-old population are by far the two lowest groups within the community who have not yet been fully vaccinated. We are seeing uptake in those areas, and we certainly expect that as CU Boulder students return to campus, we're going to see those numbers increase. But currently, if you were talking to local public health officials, they would say that our unvaccinated populations represent the greatest risk of COVID-19 transmission. For geographic distribution, you can see that there are large portions of Boulder that have more than 75% vaccination, but you can also see in the pockets down close to where the campus is located that there are some clusters there where there's lower vaccination. A portion of that is because CU Boulder students, many of them are from out of state, and that their residencies are not being filtered back into the local vaccine reporting system. That's one of the reasons why we're going to be doing our own COVID vaccination status tracking on campus, so that we'll have as much data as possible to be able to inform where we are in terms of our own vaccination and what steps we have to take in order to be able to protect our community. What we do know is that the 2-week incidence of COVID in Colorado is up. It's up to 185.4 people per 100,000 people, and that's up from a rate of 149.1 per 100,000 last week. If you look across the areas of the state, there are some that are more adversely affected than others, and Boulder is one of the communities that is not as greatly affected as some of the more rural communities. That's in large part due to the vaccination that is become prevalent in Boulder itself. But even with a relatively high rate of vaccination, the cases that are existing in Boulder are significantly higher than what they were even earlier in the summer. In the June timeframe, the rate of COVID cases dropped to 8.7 people per 100,000 who were testing positive for COVID. Currently, that has risen to about 40.6 people. And as you can see, that there was a sharp rate of escalation in July and August. And with the return of people to campus and an increased number of people in our community, there's the possibility that that rate could increase absent additional mitigation measures. What we also know is that the cases of the Delta variant predominate. And what I'm showing you is a fairly busy chart. The important thing here is that if you look across the time, the slides that show, or the bars that show orange, are the prevalence of Delta variant within our community. And the Delta variant now represents almost 100% of the cases in the Boulder community. Statewide, the Delta variant is the predominant strain in Colorado with 95.5% of all COVID-19 cases now Delta. And here are some of the things that are important to remember, which is that the Delta variant is 2 to 3 times more transmissible than the variant of COVID that we saw last year, that those people who are infected with the Delta variant have a much higher viral load compared to those who had the previous COVID-19 infection, and that people who have become infected are likely to become infectious earlier in their course and to be more transmissible. Vaccines still remain the most critical way for us to be able to end the COVID-19 epidemic. And to be clear, vaccines matter. And the reasons they matter is that you may have seen some reports in the media lately suggesting that because there's breakthrough cases, and those are the cases that are occurring in people who are vaccinated, some have questioned whether or not it's worth getting vaccinated at all if you still have the possibility of getting COVID. What this chart shows you is that the prevalence of cases in those people who are vaccinated is magnitudes of order lower than in the unvaccinated population, and also the health outcomes for those who have been vaccinated have been much more mitigated than they have been for those who are unvaccinated. Most of your hospitalizations and most of your deaths are still occurring on those people who are unvaccinated. From a hospitalization standpoint, Colorado is fortunate that it hasn't seen the sharp escalation in hospitalizations that some other states have seen. You've probably read reports showing that states like Arkansas, Florida, and Texas are experiencing severe hospitalization capacity shortages. Currently, Denver metro area is still in fairly good shape, and the Boulder County its hospitalization rate is below what we're seeing even across the Denver metro area. So that's good news, again, in large part being driven by the vaccination that people are receiving. So what I want to be able to do then now is to transition into the details of what our masking requirement is going to be on the Boulder campus. And it is this: all individuals must wear a face covering at CU Boulder when engaged in classroom instruction, laboratory work, academic advising, or other activities in publicly accessible indoor spaces on campus. An important part of that is that activities that are performed in indoor spaces that are not publicly accessible, for example, residence halls, private offices, controlled access facilities, are not subject to that requirement. Although we're recommending that unvaccinated people wear a mask covering both in public and non-public indoor spaces whenever possible in order to be able to protect themselves. Masks will continue to be required on the buff buses in line with regional transportation district requirements. And one of the things that's important to know is that anyone who feels more comfortable wearing a mask at any time is encouraged to do so, even in those settings where masks aren't required. There are some exemptions, which is that anyone who is unable to medically wear a mask isn't required to do so, and that individuals who are performing a number of activities might be exempt from the requirement while the activity is being performed. So, vaccinated instructional faculty who are engaged in indoor instructional activities such as lecturing and teaching, and who are separated by at least 6 feet from the nearest person, don't need to be masked so that can help them to be able to deliver their lectures. Same thing, vaccinated researchers who engage in laboratory work and are separated by at least 6 feet from the nearest person are also not subject to be masked. Also, we recognize that there will be a number of students who will be engaged in instructional activity or laboratory work under circumstances where wearing a face covering would significantly impede their ability to effectively perform the work, such as playing a musical instrument, giving a vocal performance, or where the ability to see the mouth is essential for communication, such as some foreign language instruction. We will be allowing people to apply for exemptions in those settings, and that the faculty, students, and staff should consult the email from our pandemic response office that was sent out today to find out about that exemption process. You can also visit our COVID-19 page to see the list. Now, we recognize that this renewed mask requirement will come as welcome news to many in the community who are worried by the surge of the Delta variant cases, while others will be less supportive of this change. What we're asking for is that people in our campus community be compassionate towards each other as we work through this and get through the next phase of the pandemic together. We want to thank you for taking care of yourselves and each other as we're moving forward. As I've described earlier, CU Boulder's vaccine requirement for students, faculty, and staff is the single greatest driver in allowing us to be able to continue our academic mission while supporting health and safety. And there's two ways for you to fulfill this requirement. The first is to submit proof of vaccination online through the MyCU Health portal. For those who are vaccinated on campus through medical services, your results will be automatically uploaded and no further action on your part needs to be taken. The other way to fulfill the requirement is to submit an exemption form online. The final deadline for completion of this requirement is September 15th. But the sooner that everyone meets this requirement, the safer our campus and community will be. And we're hoping that as many students as they return to campus as possible will be able to demonstrate that they've been fully vaccinated. Another important reason beyond providing this information in order to protect other people is to give us knowledge about what our status is. The more knowledge we have about how many people have been vaccinated, how many people are exempted, will put us in the best position to be able to work with our own public health experts and our epidemiologists and our science team to be able to make decisions about when we might not need to have a masking requirement, what steps we might need to take in order to be able to keep the campus safe. And so that information is vitally important, and we really appreciate your willingness to be able to help us gain that understanding. There are many people across the campus who have made our return possible and who are going to enable us to be able to deliver in-person instruction, be able to make sure that we're offering things like intramural sports, to have the rec center open, to have all of our dining halls and facilities operating at regular capacity. And I want to highlight and thank in particular our pandemic response office. Our ongoing response to COVID-19 is now a part of our campus operational model, thanks to the leadership of this office to guide our efforts and address our ongoing needs. Based upon our latest public health modeling nationally and within Colorado, we think that there probably will be a surge of cases at the start of the academic year. And that's one of the reasons why we put in the requirements we talked about today. We hope that with both a combination of vaccines and a sensible indoor masking requirement, that this spike will subside. We know that vaccinated individuals are far less likely to become infected, and the vast majority of breakthrough cases to date have involved mild symptoms. Our collective compliance with this requirement will minimize any surge and enable our campus to maintain operations. Our public health office will continue to provide case investigation and contact tracing, and our public health clinic at Wardenburg remains available to provide diagnostic testing and vaccines to the entire campus community free of charge. One thing that's really important here is that neither faculty nor staff should set or enforce any stricter public health related requirements than what are currently in place through the campus, nor ask people or encourage people to share personal medical information such as their COVID-19 status, test results, or vaccination status. Finally, I want to emphasize that we remain on track with our fall plans as we articulated to the campus and the community back in May. Campus has recognized that COVID is a reality that we must contend with. And as much as we wanted to put COVID in our rearview mirror, we have to recognize that we're going to continue to deal with COVID both in the short and the long term. And the campus needs to support the success of our community, both in the short term and long term. For events, we'll continue to follow state and county requirements. All previously planned events are currently able to proceed as planned for fall, but if they're indoors, they must comply with applicable masking requirements. There are no local capacity restrictions on events. And if there's any changes, we'll notify our event planners and campus community right away. We're going to continue to support individuals through our public health office and our public health clinic. And we will continue to have our COVID-19 dashboard through the fall semester and the optional buff pass for symptom tracking. Finally, if someone is sick or has extenuating circumstances that affect them, please work with your supervisor, HR, or with our disability office for the process of seeking accommodation. Thank you for attending today, being willing to listen to our announcements, and we look forward to answering your questions. But with that, I want to transition over to Provost Russ Moore.
Yeah, thank you, Pat. And even in the face of this new mask mandate, which I hope is somewhat temporary, I'm really excited to be welcoming our returning and new students to campus. This year will look nothing like last year, so I think we'll have a much more traditional and improved experience. As Pat mentioned, we continue to have safety measures in place, but are also looking forward, again, as I just said, a much more traditional experience. Like all of our faculty, staff, and students and our incoming undergraduate and graduate students are required to be fully vaccinated or complete the exemption from vaccinations by September 15th. For those who have not yet been vaccinated, we will have free mobile vaccine clinics throughout August and into early September. And you can learn more about that at colorado.edu/health. Our students will start moving into the residence halls this Sunday and throughout all of next week. And again, we're excited to have them back at full capacity this fall. With the vaccine requirement in place, we no longer have designated isolation spaces. We're excited for the fall welcome this year, where students will have a variety of events and opportunities to connect with campus. Our incoming students will take part in a range of events from college, school, and program days to Connect at the Rec, neighborhood block parties, and Welcome to Our Herd. Students can join small groups through opportunities like our residential programs and our Buff meetups, and I encourage all students to attend and be involved our Be Involved fair on August 26th. It's a great way to connect with student groups and to find other ways to get involved, and I can't stress the importance of this, and it's going to be really fun and a great experience. And since the pandemic limited what we were able to do last year, we are proud to offer a second year experience for our returning students to come together with events like See You in the Neighborhood barbecues and the Sophomore Stampede. I'm also proud of our Buffs One Read program, where we'll come together as a campus to read the same book, America Like Me, Reflections of Life Between Cultures, by actor and author America Ferrera. I hope you'll join us for an evening with America Ferrera on September 1st at the CU Events Center. I just finished reading that book, and I really encourage everyone to read it. It's a delightful read, and I think it's going to be really important for galvanizing our campus community together through this common one read. Now I'd like to shift and talk about the classroom experience that we're anticipating this year. I want to thank our faculty, administration, and professional staff, and all of the academic departments and programs, and the registrar's office, and on the facilities team who made it possible for us to move to a more fully in-person classroom experience for fall 2021. They've worked tirelessly to offer and schedule the classes that our students need in instructional modes that will work well for each class, all while the public health picture has been continuously changing. We learned important lessons from our campus's experience since the pandemic began, and we're confident in the measures that we've taken and that it'll continue to make our classrooms safe for all involved. We're also confident that our faculty who are teaching remotely have been taking advantage of the resources offered through our Center for Teaching and Learning and our Office of Information Technology to teach effectively at distance. For the fall semester, the overwhelming majority of our classes are scheduled to be delivered in person. During our last inventory at the end of last month, we counted these following numbers. 79% of our classes are scheduled to be delivered in person. And again, this is without social distancing, but they will be in person. An additional 4% of our classes are scheduled as hybrid in-person classes. 17% of our classes are scheduled as online or remote courses, and in most cases, an online lecture class is accompanied by an in-person lab, recitation, or studio session. We've been closely tracking enrollments, and we've learned that whereas most students prefer in-person learning, some students are choosing online classes based on factors such as convenience, time of day, or preferences around learning styles. And again, this is a response to some requests we had even prior to the pandemic. And I think we have a very good, healthy mix of in-person and online offerings that'll benefit students and provide more convenience for them. For our in-person classes, we're following the guidance of our expert scientific team and preparing the classrooms for use this fall. We're continuing the cleaning and ventilation measures we took last year that made our classrooms among the safest public spaces to be in. As Pat mentioned, vaccinated instructional faculty who are engaged in an indoor instructional activity and are separated by at least 6 feet from the nearest person are exempt from the masking requirement. Also, vaccinated researchers who are engaged in laboratory work and are separated by at least 10 feet from the nearest person are also exempt. Finally, individuals who are engaged in an instructional activity or laboratory work under circumstances where wearing a face covering would significantly impede their ability to effectively perform the activity or work, such as playing a musical instrument, vocal performance, or where the ability to see the mouth is essential to communication, will provide those exemptions. I know that all of our instructional faculty and graduate students who are teaching in person have questions about teaching, holding office hours, and so forth. I'm happy to answer those questions today, as is Senior Vice Provost Catherine Eggert. And my office will also be publishing a new edition of the academic instructional guidance for faculty in the next few days that will address further details of teaching and advising for the fall, and also details for planning for the classes in our spring 2022 semester. Thank you, and now I'll turn it back to Andrew.
Thank you, Provost Moore. At this time, we'd like you all to ask your questions to any of our panelists. If you have a question, please use that Q&A function at the bottom of your screen, like so many people have done already. We will get the questions started with a question for COO O'Rourke. Can staff members decide to implement protocols in offices that are more strict than campus requirements? For example, can we limit the number of people allowed in certain common areas of our office?
So the short answer is we are asking units across the campus not to be setting their own requirements for COVID, whether that's related to vaccination, masking, social distancing, etc. The campus policies are being designed in order to be able to make sure that people understand what their obligations are when they are on campus, rather than having them have to look at a bunch of different requirements that are changing from place to place. So we're really asking people not to be setting their own requirements. Of course, if you're in a situation, if somebody's not masked and you feel uncomfortable, please feel free to wear a mask yourself. And if there's an interaction that you don't believe is appropriate, ask somebody if they're willing to have a meeting by Zoom. Make sure that you're being considerate to others. But as far as requirements go, please abide by what the campus requirements are and don't create your individual unit level ones.
All right. A question here for Russ or Catherine Eggert. Will there be new academic instruction guidance available soon? In light of the new mask requirement, are there guidelines for faculty office hours, whether they need to be in person or virtual, or masks required during faculty office hours?
So the short answer to the first part of that question is yes, and I'm going to invite Catherine Eggert to give us a little more detail with regard to the timing. With respect to the utilization of masks in office hours, first of all, I really want to stress what Pat said. Let's engage these conversations with empathy. But if advising is occurring in a personal advisor's office, the advisor is free to request, not demand, but to request that if comfortable, can people please wear a mask? And they can even post signage outside of their personal advising offices to that effect. Catherine.
Thanks, Russ. Yes, we're planning on issuing the newest edition of academic instruction guidance in the next couple of days. So be looking for that. We'll send it to chairs, directors, and deans, and we're also planning an e-memo to all graduate students and faculty so that they can find the link to where it will be posted.
Great, thank you. Question here for Pat. I think you answered this one earlier, but if you want to reiterate, what does the mask requirement mean for campus events?
So for campus events, it will depend on the circumstance. And so if there is an outdoor event, such as the Buffs Back Together event, and a whole lot of our Welcome Back to Campus events, as well as things like the outdoor sections of the football games, those won't be masked. On the other hand, if there's an event that is occurring in an indoor space, that will be subject to masking requirements if it's a publicly accessible indoor space. But that because of those requirements, we're not having the capacity restrictions. So we'll be able to have events like the One Read program that Provost Moore described earlier at the Coors Event Center. We'd be able to have a full house for people to be able to come and see America Ferrera, to be able to participate in those cultural events on campus. And that's one of the things that we're really excited about that we weren't able to do last year because of the social distancing requirements and other things that we had. The combination of both the masking requirement and our vaccine uptake should allow us to be able to have a full range of really wonderful events on campus this fall.
All right. Question here for Jennifer McDuffie. Will monitoring tests be available during the fall?
Thank you, Andrew. Very good question. We will offer diagnostic testing, both rapid as well as the PCR, available through medical services at Wurtemberg. We will not be offering the surveillance and monitoring testing any longer. There's ample testing in the community that we can also share via our website if people are interested. But again, we will be offering diagnostic testing for anyone who's maybe had a known exposure, has symptoms, and can come into the public health clinic at Wurtemberg free of charge.
All right, and I'm going to stay with you here, Jennifer, for a couple of questions. We've had several attendees ask about questions about vaccination rates, and it seems like a lot of them are wondering what information will be made available about the vaccine rates on campus.
That's a really good question. As y'all know, we are very interested in how we are able to communicate and be transparent to our campus community. And so we will actually be extending the COVID dashboard throughout the semester. And we're working with a team right now and hope to have this updated by next week to be able to show the numbers of people who have met the vaccine requirement at this time. We are hoping to also break that down by affiliation. So employees or faculty and staff, as well as students. So we look forward to sharing that early or mid next week as soon as we have it built.
Okay, and another question for you. Will monitoring tests be offered this semester? Oh, I think that's pretty close to what you just answered. Person asking, what will the testing options be?
Absolutely. Happy to share. So we have been very fortunate as a campus to be able to offer about 30,000 diagnostic tests through medical services. And we have a 24-hour turnaround. And if you come in the morning, we typically get you your results that day. So we will continue to offer diagnostic testing for free at the public health clinic at Wurtemberg. We will also continue to have the optional Buff Pass that allows for anyone with a CU identity to be able to monitor their symptoms and to really determine if and when they should get a test. So we are hoping to have those continue through the semester.
Okay. Question here for Pat. Can we deny someone service if someone will not put on a mask at a service desk?
So the short answer is that this is a campus requirement. If somebody is in an indoor public space where they are required to wear a mask and they are not willing to comply with that requirement, I believe it is within the discretion of the person who's operating the service desk to be able to say that they can't provide that service until such time as the person who is seeking it would wear a mask to allow it to be provided.
Okay. A question here for Russ or Catherine, and I believe you touched on this, Provost Moore. Will more specific guidance be given about teaching foreign language classes? For example, can masks be off when speaking but on when listening? Or can instructors teach without masks as long as they're 6 feet or more away? For language instructors who teach 4 sections a day, this person says, will that set up excessive exposure for those instructors and students?
Yeah, so there's several questions in that question. So let me try to dissect it as I understand it. So to the middle question, if the vaccinated faculty member is more than 6 feet away, and if there's a pedagogical reason for them to do it, for example, a foreign language class, yes, they can take their mask off. That's explicitly in our guidance. The answer to in a foreign language class, can there be exceptions to the utilization of masks? And the answer is yes, with an asterisk. And that's why I'm going to ask Catherine Hager to help me with this guidance. If there is a good pedagogical reason, for example, musical performance, vocal performance, foreign languages explicitly, there is a process for seeking an exemption, and then we'd try to put in other safeguards if we felt they were necessary. But again, it's really this is being driven by the pedagogical need to do so, and trying to balance that against the health and safety of the campus during this period where we do anticipate hopefully a brief uptick in the Delta variant of our COVID-19. Catherine?
Just to add that the exemption process will be available very soon through CU's Public Health Office, and we'll make that information available to departments and instructors. And as far as the individual class goes, the instructor is the expert on the pedagogy. So if someone is teaching let us say a music class with the bassoons have to play for the first half of class and then they don't play for the second half of class, the instructor can ask them to put on their masks when they're not actually physically playing their instrument. And we'll leave that to the discretion of the expert in the pedagogy of that class, which is the instructor.
Okay. Question here for Pat. How long do you anticipate this mask requirement being in place? How will a decision be made about ending the mask requirement, and what data will be considered?
So that is a good question, Andrew. And so as we said from the outset, this is something that we hope is going to be temporary. I shared data with you earlier that showed the rise of cases within the Boulder community going from a low of about 8 cases per 100,000 people up to the 40 cases that we are now. And as we've described, we probably anticipate seeing another bump in those cases with the return to campus and other things that are going on in the community. Really what the science team that would be advising us, I think, would be looking for are things like what's our rate of vaccination on campus, because that informs what our relative risk are, as well as we'd probably want to see decreasing rates of COVID within the community to be able to, and on the campus, to be able to make sure that we're headed in the right direction, rather than either at an unacceptably high level and just maintaining it, or that we would be having an increasing number of cases. So we're going to want to see a consistent downward trend.
Okay, and I'm going to stay with you for a couple of questions here. Does the mask requirement change anything for staff in terms of being required to work in person? If there's a need to wear masks, this person asks, would it be more prudent to remain remote, especially staff members who work one-on-one with students?
So that is something that needs to be addressed on an individual basis with supervisors. It would be inappropriate for me to make any type of blanket announcement that would try to address all staff circumstances. If there are reasons why a particular piece of work should be done remotely, that should be something that gets addressed between an employee and a supervisor, recognizing that there's large portions of work coming up in the fall term that need to be performed on campus. And what we really need to be able to do is to best support the student experience. We know from the last year that students really felt as though the campus at times was not very welcoming, that they didn't have the in-person support they need. And so the fact that something could be done remotely doesn't necessarily mean that it should be done remotely if having an in-person presence is more conducive to student success.
Okay, and another staff question here. Is it possible to close our main office doors to maintain a space that's not accessible to the public so that staff do not have to wear a mask all day, every day?
It depends upon the nature of the office. If this is an office that is providing service to the campus and that office is going to be an office where people are able to enter and exit freely, then the closing of a door did not take it from being a publicly accessible space into being a non-publicly accessible space. If it is something that the public can access, the closing of a door doesn't necessarily remove it from the category of where a mask would be necessary.
Okay. Question here for JB. Will Greek Rush go on as scheduled this fall?
Absolutely. We're looking forward to it. Actually, Greek Rush will begin around August 26th with our Panhellenic women, and for the men, we will begin September 2nd, and recruitment will go throughout September 12th. So we're eager for it. We're excited for it. I know that students were impacted greatly from this last year, so we're doing all that we can to make sure that those opportunities are available to students this year.
Wonderful. Question here for Russ or Catherine. This person asks, if I, as an instructor, am concerned about the Delta variant, can I move my class modality to being online?
The short answer is no. And these kinds of decisions need to be made through the department chair's office and the dean's office. But I'll be very candid here. Right now, when we're looking at the conditions on the ground, if we're looking at the epidemiological data on the ground and taking into account, our incredible HVAC preparations for our classrooms, and taking into account some of the best scientific advice in the country, there is no epidemiological reason for us to be transitioning any in-person class to remote unless something radically changes with regard to the status of COVID-19 in our community. And I'll further speculate that given what appears to be a very optimistic uptake of vaccines in Boulder County, and I'm hoping that we'll see even more robust uptake of vaccines in our campus community, I think between this hopefully temporary masking requirement, our HVAC changes, and a high fraction of our population being vaccinated, I think we have multiple layers of protection that would eliminate the need for any kind of radical transition from an in-person modality to online. Furthermore, it's an expectation of the students that they're getting the modality that they signed up for, and there's no reason for us on a public health basis to change that at this time. Catherine, I don't know if there's anything you'd want to add.
Yeah, I just want to add, I know there's concern from the students' perspectives and sometimes from the parents' perspective too, that faculty can just decide themselves independently, I'm going to teach this in-person class remote. I just want to emphasize that isn't true. A faculty doesn't determine their own instruction mode. It's in concert with their department and their dean, and in fact, during the pandemic, in concert with the provost's office. So over the summer, we have in fact seen more in-person classes added. So we have significantly more in-person classes even than we did back in March or April when we were just starting to publicize the fall schedule.
Andrew, can I add one piece onto that?
Please.
Which is that if there was a reason, such as that a person was immunocompromised and that they needed to seek remote work or remote teaching because of that, there is a formal process to be able to seek those type of accommodations, and that people should go through that process if necessary. But that is for those cases where somebody really does have a health condition that would limit their ability to be able to safely teach in person. But it's important to use those formal processes when seeking those type of accommodations.
Really important points there. Question here for Jennifer McDuffie. What does CU have in place to verify student vaccine information?
A really good question. We actually, and I'm so proud to work with these folks. Some of them may actually be on the call, but we have an incredible immunization and compliance team that's built into our process. And not only for the COVID vaccine, but for any vaccines that are required for the campus. And so once someone submits their information, whether that be proof of vaccine or the exemption, it takes about 2 minutes at most. And then we actually have people, individuals, humans who are part of CU that go through state databases to verify that the information was indeed correct. So we do have a verification process. We also have begun emailing and confirming verification and/or any next steps, and encourage people to submit as soon as possible, because we want to make sure that not only you're able to get that completed, but also we're able to share the completion with the campus.
Okay. Question for Jennifer or JB. This person says, my son was recently assigned a dorm roommate. If it's not appropriate to ask my son's roommate if he's exempt or plans to be exempt from full vaccination, how can I appropriately learn this info?
Thanks, Andrew. I think that's a great question, but I think it's also the centerpiece for a student-to-student conversation around these concerns, and certainly to make sure that the parents are informed and things of that nature. But it does come down to roommate kind of having a discussion. And I know that it's one that is sensitive, but it's one that is important. And I would encourage the students to have those kinds of conversations. Dr. McDuffie may have other comments, but I think that's a good start.
Thank you, JB. I think that the conversations are really important. Living in an environment for the first time with another person who you may or may not know, I completely agree. Having those conversations, but also conversations around cleaning, expectations. What happens if a person gets ill? And that could be a variety of things, from stomach flu to a headache. And what are those basic things that we can do to support one another? I also think that, in terms of the residence halls, we have enforced and implemented so much enhancement to ventilation, to cleanliness, and we do a lot to talk about what it is that we can do within the residence halls, but also how do we have our students equipped with materials, with information to be able to support themselves. So for example, if it is a situation where there's a suite, we'll help with, how best to support cleaning. The other thing that I would also encourage is, for many of our students, the residence hall is their home. And just like you would have a conversation with who you live with at home, let's have that same conversation, those same expectations, and really make sure that we keep our home as safe as possible.
And if I may add, Andrew, quick, thank you, Dr. McDuffie. One of the other things I'll add is we do have an office that works with conflict resolution. So as another layer, I think that it's important for students to understand the resources, and certainly we have those if need be.
Very important point. Thank you, both of you. Another question for Jennifer and JB. We'll stay with the two of you here. How will this new mask mandate announced today change how sports clubs operate for the fall? Will they be able to still practice at full capacity? And what will happen to sports practices where masks can't be worn? For instance, swimming.
Very good question and very good point. We want to make sure that everyone is safe, and a mask while swimming would not help us with that goal. One of the things that I'd say, and I believe some folks may be on here, but our recreation services team is really incredible. And I'm meeting with their leadership as well as the public health office to really ensure that we look at those individual types of competition, where they're happening, what those practices look like. The mask mandate was intended for indoor public spaces. And for so many of our sports teams and our intramurals, that may not apply. So we want to make sure that we're promoting as much information as we can, but also the health and safety. So I would say for those club teams, we are so excited to have competitions and practices back. And we want to make sure that it's in the best type of environment. And for many of that, it will be outdoors. And when it's not outdoors, how do we work with you to ensure that safety? So we'll be doing that on an individual basis.
Great. Question for Pat here. Will you require that those that have vaccine exemptions to test regularly to be able to enter the classroom and other indoor spaces?
So the answer to that question, Andrew, is no, we are not going to be requiring unvaccinated people to do surveillance testing in a way that is inconsistent with how we're treating the rest of the campus community. We talked to our science team and that they saw there being little public health value to doing surveillance testing of that type. And so we are not recommending that, because I don't believe that we should have people testing for appearance purposes rather than if there is a legitimate public health aim to be served by doing the testing.
Okay. Another question for you, Pat. Sorry, I'm going to stick with you for a couple here, just as a heads up. Is there data specific to CU, this person asks, that prompted the decision to require masks?
I wouldn't say that we have CU specific data. What this is really being based upon is community level data that we've received so far. Obviously, because we haven't been in session with all of our campus community here, we don't have a full set of data that would be able to inform what our experience would be. So what we really want to do is to be able to look at what's happening at a population level, both in the Boulder community, in the state, as well as what's happening across the country. And we're probably taking a position right now that is most protective, but we're hoping that by doing that, we'll be able to maintain in-person classes, avoid restrictions on capacity, not have social distancing in the classroom, and be able to make it through this in a short period of time, so that we'd rather be on the front end of those mitigation measures than on the back end.
Okay. Another question for you. It was my impression, this person says, that in the spring, the campus was going to enforce vaccination for everyone. I see now there's an exemption option. Is this a change in the policy?
Nope. From the moment that we announced a vaccine requirement, we were very clear about what the nature of the exemptions would be. Those are consistent with what the framework has been governing vaccinations in a lot of educational settings, including higher education for Colorado for a long time. And so we wanted to align that most closely. But what we've seen is that even when exemptions are available, that a large number of our community has responded to that requirement. For example, we've had measles, mumps, and rubella for a student vaccination requirement for years. We get over 90% of our students who avail themselves of that vaccine. If we are in a situation where over 90% of our campus community avails themselves of the COVID vaccine, we'll be in a really good place, and we should see whatever spike we get abate quickly and allow us to be able to move forward with a more normal fall semester.
Okay. Question here for Russ or Catherine Eggert. How will the mask requirement affect the performing arts? This person asks, will we have to continue performances online, or will performances be done in person with performers in masks?
So the intention is that the performances will be done in person, and those who are conducting performance classes, or vocal, musical instruments, vocal, things like that. We would ask that they go through the pedagogical exception process so that we can make sure that we allow people to be in person, to conduct their performances, and to do so in the safest way possible. I want to go back to something Pat said. If we can achieve a 90% plus vaccination rate in our campus community, that's an incredible upside for us. And that would allow us to hopefully make more temporary this masking mandate, and also to allow people to conduct these performance classes with greater safety assurance. Catherine?
Yeah, I will just add that the public health office on the CU campus is already working with individuals who are interested in, their particular situation regarding performance. And so I will encourage everybody who has individualized situations about a performance, either a class or a performance they're giving for the public, to work with the public health office on the best health and safety measures.
Yeah, and if I can just add one more thing, our absolute commitment is to try to safely conduct as much of our pedagogy on campus in person as possible. So safety is, again, a foremost concern, but as is the importance of conducting our in-person pedagogy as appropriate, which would include these performance classes, foreign language classes, or any other class that is so important to be conducted in person. And with the exception of those courses that are being offered remotely for the purposes of convenience for our students, we are going to remain steadfast in that commitment unless things somehow change inexplicably with regard to conditions on the ground.
Okay. Question here for JB. Will there be designated spaces for eating or drinking, or will it return to the pre-pandemic setup where eating and drinking are allowed in most spaces?
That's great. So we are planning to have a complete dining experience on campus. I know that it was interrupted quite a bit last year, and we were doing all that we could to meet the demands of our students who wanted to connect. Those are places of connection. So we will have opportunities to dine just about anywhere on campus, and students can expect a variety of different meal options.
Wonderful. This is going to be our last question as we run out of time here, and we're going to send it to Catherine. This person says, I'm at high risk for COVID with my son living with me. I'm concerned about his CU attendance and contracting COVID and passing it to me. Are there any online class accommodations that can be made for him to prevent this possibility?
So any student who wishes an online or remote class schedule should work with their academic advisor on their possible options. I do want to say to this parent again, though, that we believe that with our vaccination requirement, with masking in the classroom, we are providing as safe as possible environment in the classroom, safer than other places that the student could go, like the grocery store or such like. So while I completely empathize with the anxiety, both of someone in that situation or an instructor who might be in a similar situation, I just want to reassure folks that our safety measures in the classroom are unparalleled.
Okay, thank you so much. And to reiterate to everyone, I know that we had a lot of questions that we were not able to get to. We had a lot of questions on here today. If we were not able to get to your question, please visit colorado.edu/COVID-19. There's a chat function in the bottom right-hand corner of that website. You can ask your question there, and we can hopefully get you an answer to that question. We're excited to see everyone in the fall as the fall semester kicks back up. And with that, we will end today's call. Thank you all for joining.